Hello, good evening, friends. Hello, friends. This is Dr. Roy from Mumbai, an allergist, immunologist, and asthma specialist. Welcome to this Facebook Live event where we speak about children who have been suffering from recurrent respiratory infections, what the causes are, what we can do about it, and how we can go ahead and enhance the lives of the youngest generations and our future. Children with respiratory infections make up about 40% of all visits to a pediatrician's office and about 10% of all hospital admissions that children have. These respiratory infections and respiratory problems can include cough, which can be dry or wet, wheezing, chest tightness, breathlessness, inability to sleep at night, also cold, nasal congestion, blocked nose, runny nose, sneezing, and a variety of other respiratory symptoms, including ear infections, sinus infections, recurrent headaches, and even problems that can lead to hospitalization due to difficulty breathing, requiring nebulizations, steroids, antibiotics, and more children are being seen experiencing these problems these days. These children are of all ages, right from the youngest, who are a few days old, to children who are 12, 14, 16, or 18 years old. And all around us, these respiratory problems are increasing day by day. And the reasons behind this are multitude, including genetics. So if there is a parent or a grandparent or a sibling who has allergies and asthma, this problem can be noted. If there are any smokers in the home, the risk of respiratory infections goes up. The risk of respiratory symptoms goes up. Living in very closed, crowded quarters can also increase risk of respiratory problems. Biomass fuels used in certain parts of metropolises as well as interiors of India can also lead to respiratory problems in children. Add to this the westernization of our diet and lifestyle. More and more people these days are eating processed food, ready-made food, food that is not freshly prepared, that has been preserved, that has chemicals, that has adulterants, which can then damage a child's gut digestive system, where 80% of his or her immune system resides. And this immune system, when it gets imbalanced, is when a child starts getting allergies or asthma or recurrent respiratory infections, which can then become a chronic problem. And this problem can truly become a persistent issue and cause permanent lung damage that has been shown in studies. And so it becomes very important that we do everything that we can to take care of our children and their lungs so that they can grow up to be healthy, strong adults who are the future of our country. And in this process of prevention, the steps begin right from birth, or I would say even before birth, because the mothers diet and lifestyle during pregnancy will determine whether the child has a healthy immune system and also a healthy respiratory system. And in this process, recognizing that more and more mothers need to watch their diet, need to take the right steps to reduce stress levels, because even maternal stress during pregnancy has been shown to increase the risk of wheezing and even eczema, which is one of the precursors of allergies in children early in life. And so, in this process, as mothers take care of themselves and babies are born, it is very important that the home environment of the baby be kept clean. Because we all believe that outdoor air pollution causes respiratory problems. We've seen it. And now that India has amongst 14 of the most polluted cities in the world, unfortunately, according to WHO, we know that outdoor air pollution is a problem. But in reality, indoor air pollution also is a problem and can sometimes be 5 times worse than outdoor air pollution. And so making sure that the house is well ventilated, that no kind of biomass fuel, smoke, and particles can accumulate inside the house, that biological pollutants like insects or pests, because cockroaches, animal dander are known triggers for allergies once a child gets sensitized. And so limiting these and airing the home adequately, where possible, bringing sunlight into the home through open windows and doors also become very important. If a child does have recurrent symptoms, it becomes very important that the child is taken to a specialist for further evaluation, because early intervention in these conditions can go a very long way in preventing these diseases and preventing this from causing a chronic problem which can cause lung damage in the child. If there are any smokers in the home, they need to ideally quit smoking because it's not good for themselves. But definitely they should not smoke inside the home, so that the baby or the child is not affected by second-hand or passive environmental tobacco smoke exposure, which is a well-known trigger for respiratory diseases in children of all ages. Besides this, timely allergy evaluation, because if there are recurrent colds, sneezing, runny nose, blocked nose, it might be the sign of nasal allergies. And in these situations, it becomes very, very important that the child is evaluated either through an allergy skin test or through an allergy blood test to know what their sensitizations are. And with this kind of precaution and prevention, we can make sure that the child has the best chance for healthy lungs and a healthy life, and making sure that the diet is as well aligned culturally and regionally to provide the best kind of nutrients and have the least kind of processed foods in it, with preferably a good divine diet counseling that can be done of the parent and child to optimize their immunity. And with that, friends, I shall now complete this part of my introduction to respiratory diseases in children, which are on the rise immensely all over India and all over the world, and be open to take some of your questions. Do we have any questions from any of our online friends? So there is a question from Mr. Dora which says, how can we stop the normal diseases which rise from pollution? So air pollution is clearly a problem that occurs outdoor and indoor. For outdoor air pollution, really it's more of governmental and policy matters on how it is controlled with regards to planting adequate trees, improving air quality, reducing vehicular traffic and pollution, improving the quality of how these um, different pollutants are released by the various vehicles through some good pollution checks and follow up in that matter. When it comes to indoor air pollution, one of the first things is aerating the home well. Besides that, making sure that any source of chemicals or toxins in the air are eliminated. Use of a lot of agarbattis, dhoops, smoking inside the house, cooking with biomass fuel, these are all known triggers of indoor air pollution. And besides this, a good quality air purifier can make a difference to a person's breathing, including a child's breathing. And generally an air purifier that has a multiplicity of levels of cleansing. There are a lot of different technologies, including carbon filters, HEPA filters. There are a lot of different methods by which the air can be purified. There are special ion technologies by which an air purifier can reach even beyond where the normal air can be pulled into the circulation of the air purifier. So really having a reach that's beyond is what is very important for air purifiers. So these are some of the ways in which we can take care of these. So several people have asked that if we cannot ventilate the home for long, or we know that air pollution is a problem and kids are having trouble with colds and runny noses, what can we do? In these situations, if a house cannot be ventilated adequately for at least a couple of hours every day and there isn't enough sunlight coming in, then the only option that remains is to make sure that the indoor sources of chemical pollutants are reduced, the biological sources of pollutants are reduced, good pest control is done so that insect infestation does not occur, and besides that, using air purifiers, which can go a long way in cleansing the air. And in these situations, the choice of the air purifier is something that I would recommend people to do with guidance from their healthcare provider, because there are too many options in the market, and knowing which one is right, which has multiple layers of air purification, HEPA filters and other such systems, becomes very, very important, because just having too many sensors on the device or having too many bells and whistles does not guarantee that the air purification is perfect. And the reach of the air purifier has to be adequate so as to match the size of the room that it is placed in. If a person continues to have nasal allergy symptoms, sneezing, cold, runny nose, blocked nose, despite of using an air purifier, it does not mean that the air purifier is not working. What it means is that the person needs further allergy evaluation. They need to be checked by an allergist, immunologist, have allergy skin testing to find out what they are sensitive to, because sometimes specific elimination is required, and also sometimes specific medications and immunotherapy is required to treat these allergies. So an air purifier is an adjunct to treatment and to taking care of our children, but it is not the only solution to a problem when it goes beyond a certain level. A question has come, are commonly available air fresheners safe for use? Many of the air fresheners are tested and tried in labs to make sure they don't have any toxic ingredients, but not all of them. And certainly some of the aerosols that are used in air fresheners can cause an irritant response in a child or an adult with asthma or allergies and lead to problems above and beyond what they may have without the air freshener being used. So in this situation, it is very important to carefully use any household products, including even perfumes, including even the use of deodorants or any strong smells or chemicals which can be irritants and cause problems. Someone asks, could there be a problem due to mold in the house? So certainly amongst the indoor allergies, house dust mites, which you can't really see, mold, which is fungus, which can come on damp areas, areas with water damage, leakage, um, animal dander, presence of infestations such as cockroaches or rats or mice. These are all potential sources of allergens. And so a home that has molds in it can certainly have people, because molds, even without causing allergy, can be an irritant to the respiratory system and cause sneezing or cough or headaches or some non-specific symptoms also. Another question has come up, will the immune system get affected by pollution? Air pollution doesn't only cause respiratory diseases. Air pollution actually has been associated with heart disease. It has been associated with strokes. It has been associated with cancers. It has been associated with heart attacks. So many aspects of our body and immune system get affected due to air pollution. And this air pollution, both outdoor air pollution and indoor air pollution, can cause a multiplicity of problems for an individual, because it is what we call an oxidative damage and a chemical damage for the respiratory system. And this oxidative and chemical damage can then lead to a variety of diseases, not just respiratory diseases of the upper or lower respiratory tract. Another question has come up, are children more prone to respiratory illness? So kids and elderly individuals, senior citizens, so those below the age of 5 or 6 and those above the age of 60 are actually the most prone segments of our population who are known to have respiratory illnesses more than other ages. And that's because in the first half of life, maybe even up to 6 or 7 years of age, the immune system is not completely mature, and hence infections occur with greater frequency. And as the person ages above the age of 55, 60, again there is immune senescence or aging of the immune system, because of which infections increase, including respiratory infections.